June is right around the corner, and you know what that means? Summer. And with the sun shining and the temperatures rising, it's important to protect yourself from not just the sun rays, but the heat and humidity as well. Today, we're going to discuss ways to help keep you and your family safe and healthy during the summer months, as well as answer any health-related questions you may have. Next on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Nurse Katie, and today we're going to talk about having fun in the summer sun and being careful, two things that don't have to be mutually exclusive. Let's kick things off with a YouTube question from Colleen. Hi, Nurse Katie. Warmer weather means it's pool season. I'd love some pool safety information if you don't mind. Colleen, that's a fantastic question. Keeping a close eye on kids around the pool is super important, whether it's in-ground or above-ground pool. With above-ground pools being taller, it's tough to keep an eye on what's happening inside the pool, so constant supervision is key. Unfortunately, I have seen several cases in the ER with children drowning in above-ground pools because there is no visual. Aside from watching over the little ones, it's essential to teach them not to run around the pool. Kids love to goof around, run on the deck, but it can get slippery, and that's when accidents happen. And hey, let's remind the kiddos, it's always good to go in the pool feet first. Most pools aren't deep enough for diving anyway. And we also need to talk about those pool toys, like those pool noodles. They're not meant to assist with floating. It's easy to think they'll keep you safe, but they're not buoyant. So if the little ones can't swim, make sure they have a Coast Guard approved life jacket on. Hey, it looks like we have another viewer question related to the pool. This one is from our website, allhealthtv.com. And this question is from Pablo. Hi, Nurse Katie. I've heard that it's not necessarily a good idea to buy a swimsuit that my child loves. It should be brightly colored. Is that true? Hi, Pablo. Thank you for drawing attention to this very important topic that rarely gets discussed. It's surprising, but when choosing swimsuits for your children, the color is very important, and it's even more important in the style, design, or their favorite cartoon icons, because drowning is the leading cause of death for children aged 1 to 4 years old, and the second leading cause of injury or death for children aged 5 to 9 years old. The color and the visibility of your children's swimsuits underwater could potentially save their lives. Drowning happens quickly and silently, unlike what is often portrayed in the movies. Children don't splash around and yell for help. Instead, they might just bob up and down slowly on the surface, struggling to get air. Some swimsuit colors can blend in with leaves or debris underwater, making it challenging to spot a struggling child. Other colors can virtually disappear in the water, so you don't see the child at all. Fortunately, drowning is also the most preventable childhood injury. Before purchasing swimsuits for your kids, it's essential to consider the visibility of the colors in the water. Boy, oh boy, our viewers really want to get their swim on. Saul just reached out to us via YouTube with his question. Saul asks, Nurse Katie, I know you kind of addressed this already, but any chance you have more water safety rules you can share with us? Saul, you came to the right place, and have I got additional rules for you? If you're in a pool without a lifeguard, it's smart to know how to get help in an emergency, whether it's having your cell phone handy or knowing where the emergency phone is. Pool safety matters for everyone, not just for kids. Here are some more important tips to help keep you safe this summer. Always have a buddy when you swim. Never go alone. Follow all the rules and signs posted around the pool. Stick to swimming in areas where there is a lifeguard. If you're not a strong swimmer, it's always a good idea to wear a life jacket near the water. Watch out for feeling too tired, too cold, too far from safety, too much sun, or too much strenuous activity. Set some safety rules for your family based on how well everyone can swim. like staying in the water that's less than chest deep if you're not a strong swimmer. Know your surroundings and any potential dangers in the water, like deep and shallow spots, currents, any wildlife, and where you can get in and out on your own. Learn how to stop, spot, and handle emergencies. And remember, it's best to avoid alcohol if you're going to be swimming, diving, or boating. It messes with your judgment and makes it harder to stay safe in the water. How'd I do, Saul? In case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, this is getting crazy. I know summer is almost here, but 4 questions in a row about swimming or being in the water? Wow. Molly's question comes to us from Facebook. She asks, what should I do if I see someone who looks like they're drowning? Molly, I'm glad you asked that question. Always remember that your own safety is top priority. If you cannot safely help the person out of the water, get help from a trained responder, such as a lifeguard, or call 911 or the local emergency number and wait for help. Stay on the phone with the dispatcher until they tell you it's okay to hang up. Here are things you should do if someone is drowning. Call 911, move the person to dry land. But remember, like I said before, only if you can remain safe. Check for breathing. If the person is not breathing, check for a pulse. If there is no pulse, start CPR. Repeat if the person is still not breathing. I'm going to go through a brief little rundown on how to administer CPR from a non-healthcare worker standpoint. It's crucial to remember these steps below. Ensure the safety of yourself and the scene around the patient. If you haven't already called 911, do so, or any other emergency available service. For adults, administer 30 compressions at a rate of 100 to 120 per minute with a depth of 24 inches or 6 centimeters. Place both hands in the center of the chest between their nipples. For children aged 1 to 8, use one hand to compress about 1/3 to 1/2 the depth of the chest. For infants and babies under 1 year of age, use your index and your middle finger and just lightly compress the breastbone. After 30 compressions, provide 2 rescue breaths, each lasting about 1 second. You want to watch for the chest to rise with each breath. If you are uncomfortable giving these rescue breaths, you can also just do the CPR. Look at this. Finally, a non-water related question from a viewer. This email is from Eldred, and he asks, so Nurse Katie, what can be done to prevent sunburn? I know this maybe sounds like kind of an obvious question, but it's always a good idea to remind people about the dangers of getting sunburn and what you can do to prevent it. Thanks, Eldred. It's important to remember that even though it might feel like spring everywhere else, here in Florida, it's really already summer. With the summer season comes the increased risk of sunburns. While sunburns may seem like a temporary discomfort, they can lead to long-term damage and health issues. Spending the time outdoors offers so many benefits, such as staying active, reducing stress, and getting essential vitamin D. However, it is crucial to protect your skin from the sun to avoid raising your risk of skin cancer. Most skin cancers are caused by overexposure to UV rays, which come from the sun, tanning beds, or any other kind of sun lamp. It's important to remember that UV rays can reach you on cloudy days even and reflect off surfaces like water, cement, sand, and even snow. So what can you do to prevent sunburn? Well, one of the easiest things you can do is seek shade. You can lower your risk of sun damage by just staying in the shade under an umbrella, going underneath a roof, a tree, or any other kind of shelter. Using sunscreen or wearing protective clothing is also vital while you're in the shade. Whenever possible, opt for a long sleeve shirt, long pants, or a long skirt to shield yourself from the UV rays. If this isn't practical, wearing a t-shirt or a beach cover-up is actually a really good alternative. Clothes made from lightly woven fabric offer the best protection. It's important to note that a wet t-shirt provides less UV protection than a dry one. And darker colors, even though they might feel warmer, actually offer more protection than any lighter colors. For even more protection, you can wear a hat with a brim that shades your face, ears, and the back of your neck. Choose a tightly woven fabric such as canvas to safeguard your skin from UV rays. Avoid straw hats with holes that let sun through. Darker hats may offer more UV protection. If you prefer a baseball cap, make sure that your ears and the back of your neck are covered with clothing, sunscreen, or shade. You could also wear sunglasses to protect your eyes. Sunglasses not only protect your eyes from the UV rays, but also reduces the risk of cataracts in the future. And also it shields the delicate skin around your eyes from sun. Opt for sunglasses that block both UVA and UVB rays for the best protection. But Katie, what is UVA and what is UVB? UVA is a longer wavelength that penetrates deeper into the skin, reaching layers beneath the surface. UVA rays are usually associated with skin aging and inflammation and can lead to skin cancer, while UVB are shorter waves and cause the skin to burn. UVB is a major driver of skin cell mutations that cause the skin cancer. You can also use sunglasses that wrap around, and they will also block the side of your face. The next way to prevent is obviously wearing sunscreen. Always apply a broad spectrum sunscreen with SPF of 15 or higher before going outside. And broad spectrum covers the UVA and the UVB waves that we spoke about a little bit ago. Make sure you apply a thick layer to all exposed skin and ask for help if you can't get to hard reach places like your back. Remember, sunscreen is most effective when used in conjunction with the other protective measures. It's important to note that sunscreen is not recommended for babies under 6 months old. Try to keep them in the shade or just out of the sun completely. Remember to always reapply your sunscreen. It can wear off very easily whether you're swimming, sweating, or you're toweling dry. If you've been out in the sun for more than 2 hours, it's also time to reapply that sunscreen. And always check the expiration date. The expiration date on your sunscreen usually it only lasts about 3 years. And if it's exposed to high heat, the temperatures can shorten the shelf life of it. I completely understand the pain that comes with sunburn. It's important to treat it as soon as you notice it. The first thing you can do is get out of the sun and seek some shade. Taking a cool shower or bath can help relieve the pain. But be sure not to stay in for too long, as it can dry out your skin. And also please avoid using harsh soaps or exfoliating your skin, as both can further irritate. After taking a shower and gently patting yourself dry, leave your skin slightly damp so that can help trap the moisturizer in when you apply it. It's best to avoid petroleum base like a Vaseline, as they can trap the heat and worsen the sunburn. Instead, try a light moisturizer or a gel that contains aloe vera or soy. You can also apply a cool compress to your skin to ease the discomfort. Drinking extra water is actually really important also, because the sunburn draws fluid away from your body, and you want to avoid feeling dehydrated. Remember to stay out of the sun entirely until the burn heals, as sunburned skin is more vulnerable to further damage. Speaking of sunburns, Blair just submitted a really important question to us via Facebook. Hi, Nurse Katie. Thanks for sharing all the great information. My question is, what is the difference between a first-degree sunburn and a second-degree sunburn? Thanks for the kind words, Blair. I love my job and I love helping people. It can be really painful and uncomfortable to have any type of sunburn. Sunburns can be classified as first or second degree, depending on the depth and the size of the affected area of the skin. A first-degree sunburn may cause the skin to turn anywhere from light pink to bright red, and it would be painful to touch. In this type of burn, only the upper layers of the skin are affected, and it should heal within a couple days. A first-degree sunburn may cause the following skin symptoms, usually about 4 hours after you get the sunburn. Your skin might be more red. You might have a warm or kind of a tight feeling. You could have swelling. You could even have some blistering of the skin, and you're probably going to be a little sore. Peeling skin may occur about 3 to 8 days after the exposure. And other symptoms you might have are headaches, your temperature might go up, you might feel tired, and you might even feel a little nauseous. A second-degree sunburn is more serious, causing the skin to become severely red, swollen, and blistered due to damage to the deep layer of the skin and the nerve endings. This type of sunburn is more painful and will take about 2 weeks to heal. Some symptoms of a second-degree burn may include deep red skin, swelling and blistering of a very large area. Your sunburn might look wet or have very shiny skin. It'll be painful, and there might be some little white discoloration within the burn. People with second-degree sunburn can follow the same steps to ease their symptoms, but they may need further advice and treatment from a healthcare professional. It's important not to pop blisters, as doing so could impede healing and lead to infection if the dermis is exposed, allowing bacteria to enter. Signs of infection include oozing pus or red streaks on the skin radiating from the blisters. Whether it's a first or a second-degree sunburn, your skin may start to peel a few days after the initial burn. This means your body is trying to get rid of those damaged cells. It's important to let the skin fall off naturally. For the same reason you don't want to pop a blister, you also don't want to peel the skin yourself, because you could introduce bacteria and risk an infection. If you've got questions, we've got answers. And just in case you missed it the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
As painful and potentially hazardous as a second-degree sunburn can be, it's not the most dangerous affliction to be concerned about during the summer. Check out the question we just got via YouTube from Colin. Colin asks, "Hi, Nurse Katie. What's the difference between heat stroke and heat exhaustion, and which is more dangerous?" Colin, this might be the question of the day. Before we do a deep dive on this important topic, let's check out this video from our friends at Mayo Clinic.
Your body is like a car's engine. If it starts to overheat, the warning light goes on, and that is heat exhaustion.
Which is where you feel nauseous or dizzy, or you just don't feel right, and you're sweating profusely.
Anyone at any age can suffer from heat exhaustion. High temperatures, particularly when paired with high humidity, are the primary cause.
Ways to prevent it include hydrating a lot, dressing appropriately for the weather, going into an air-conditioned place when you don't feel quite right, taking breaks if you're outside working.
Without prompt treatment, heat exhaustion can lead to heat stroke, a life-threatening condition that requires emergency medical attention.
The management of heat stroke is giving them fluids and dunking them into a cool ice water bath as quickly as possible.
A common symptom of heat stroke is an altered mental state or behavior.
The pearl, I always say, is to look for confusion. If they are confused, they are having heat stroke. If anybody is in the heat and they're feeling nauseous and just not quite right, they should take a break, hydrate with cool water, and just sit down for a little bit and let their body cool down.
Big thanks to our friends at the Mayo Clinic for that very enlightening video. As the weather gets warmer, we tend to spend more time outside under the hot sun. It's important to know the difference between heat stroke and heat exhaustion. Heat exhaustion occurs when your body loses excess amounts of water and salt, typically from sweating. On the other hand, heat stroke is a serious medical emergency that occurs when your body is unable to control its internal temperature. As the weather gets warmer, we tend to spend more time outside under the hot sun. It is important to know the difference between heat stroke and heat exhaustion. Knowing the signs and symptoms of these two conditions could save your life or that of a loved one. So you may be asking, "Hey, Nurse Katie, what are the symptoms of both?" So let's do that deep dive that I was talking about earlier. First, let's go over the symptoms of heat exhaustion. Heat exhaustion, you might feel some general weakness, feeling tired. You might start sweating a lot. You might feel that your pulse is beating faster. You might feel like you're going to throw up, or you actually do. And if it does get pretty bad, you might even faint or feel like you're going to faint, feel lightheaded, dizziness, like the room is spinning around. So what should you do if you feel this way? If you or somebody you know is displaying these symptoms, You can move to a shaded area, remove unnecessary layers of clothing, take a cool shower or use a cold compress. Make sure to hydrate with water, lots and lots of water. Sports drinks are okay. Sometimes you can flavor your water, but really ultimately just try to drink that water, suck on ice cubes, things like that. And if you do feel like you're gonna pass out, lay down so then you don't fall and hurt yourself further. If you do start vomiting, that's usually when you do need to go seek medical attention because you already have the heat exhaustion, you're gonna be dehydrated, and the vomiting is just going to make the dehydration even worse. So the symptoms of heat stroke are a little different than those of the heat exhaustion. So heat stroke, your body temperature is going to go up. Normal is about 98.6. Well, your temperature is going to go up to 104. You're going to have still that rapid pulse. You're going to have probably a loss of consciousness, or you're going to feel different. You're going to feel confused and a little bit slow to respond. Your skin's going to get hot, wet, and dry. Sometimes you'll have the moist skin from sweating, but you're going to feel really warm. So what do you do if you have these symptoms? So if you have them or somebody you love has them, you should probably either call 911 or if you have a safe ride, drive to the nearest ER. If you're unable to get to the ER right away, move to a shaded area or a cooler area. Try to get some circulating air, turn on some fans, have people fan you so you feel a bit cooler. If able, you can use a cold compress, a wet washcloth. You can even try to get into an ice bath. Keep in mind that heat stroke can be much more serious than heat exhaustion, and it does require immediate medical attention to prevent complications. If you're experiencing heat exhaustion for an extended period of time, it can lead to heat stroke. Heat stroke can come on quickly if it's very hot or if you're overexerting yourself. That's why it's important to begin treatment at the first signs of heat exhaustion. Here are my final suggestions to help prevent any type of heat-related illness. Wear loose fitting clothes when out in the summer sun. Don't overexert and don't drink alcohol, as it actually makes you dehydrated. Spend time in the shade as much as you can. And lastly, drink plenty of water. All right, our last question of the day is, of course, another water-related one. This one is from our website at allhealthtv.com, and it's from Lupe. Lupe asks, Nurse Katie, my husband and I are in our 60s, and we've noticed that we don't drink as much water as we used to. Now that it's summer, what are the signs of dehydration, and what can we do to prevent it? Another important question from one of our viewers. Thanks, Lupe. All right, so first things first, one of the consequences of aging is addition to a diminished sense of thirst is your body simply has less water than it did when you were younger. In other words, older people have a built-in water deficit. That's one reason why it's so important for seniors to stay hydrated. Dehydration occurs when your body doesn't have enough water. It's important to remember to drink water even before you feel thirsty. Feeling thirsty means your body is already mildly dehydrated, which can lead to discomfort such as headaches, fatigue, and dizziness. Severe dehydration can even result in life-threatening conditions like heat stroke. Please remember to take care of yourself and stay hydrated. When you aren't properly hydrated, your body's natural response is thirst. You should respond to that right away by drinking fluids, preferably water. You can usually treat mild dehydration by drinking more fluids. Guess what? We've got one more video from our friends at Mayo Clinic, and this one has to do with staying hydrated.
Sometimes signs that you're thirsty, sometimes your brain mistakes that for hunger, even irritability, dark colored urine, or even dry skin. Those are some signs that your body is thirsty. Even though your brain doesn't tell you, I'm thirsty for a glass of water, sometimes your brain mistakes that for hunger. The downfall to not drinking enough water is it can damage your organs, down to your kidneys, most importantly, skin. Your organs do need water to function properly on a daily basis. What I usually tell my patients is if it contains caffeine or alcohol, that doesn't count towards your water intake for the day. Reason being is that alcohol or caffeine can actually act as a diuretic where you're going to be going to the bathroom more, which can actually cause you to lose more water. So with that, drinking straight water does count towards those 8 glasses of water per day. Sparkling water is okay as well. I think that unless you have a sensitivity where you have any bloating, but definitely sparkling water is an okay alternative as well.
Thank you for another informative video from the folks at Mayo Clinic. So I'm going to go really quickly into some symptoms of dehydration. You can have dry tongue and lips, some dry wrinkled skin. You might have some muscle cramps, especially in your calves. And you might notice, like they said in the video, that your urine is darker than usual. Some things with children is there's no tears when crying, and they won't have wet diapers, so you have to seek medical assistance. Well, that's it for this episode of Ask the Doc. Thanks for watching. We'll see you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.